Okay, this is chapter 4 on body structures. This is probably one of the most important chapters for any field of healthcare that you're interested in going into. Okay, so the levels of organization of life. Life starts at cell. A group of cells that function together are called a tissue. A group of tissues that function together are called an organ. A group of organs that are function together are called a system. And a group of systems that function together are called an organism. For your purposes for this class, the ones you need to know are cyto, meaning cell, histo, meaning tissue, viscero, meaning organ. I always think of the saying, I had a visceral reaction to that. When someone says that, they kind of mean like, I felt it in my guts, like it punched me hard or something like that. They had a deep emotional reaction. So that's how I remember that viscero is organ. Your body cavities, and you would be getting this in either structure and function or anatomy and physiology, depending on which uh, program you're in. But basically, we have a dorsal cavity in the back and a ventral or anterior cavity in the front. Within the dorsal or posterior cavity, you have the cranial and spinal cavities, smaller mini cavities. Within the ventral or anterior, you have the thoracic, you have the abdominal and pelvic, sometimes called the abdominopelvic cavity. And the diaphragm separates the thoracic from the abdominal. Okay, body planes. Mid-sagittal is this front one that cuts a body exactly left to right. If it's mid-sagittal, it's right in the median and it's two equal halves. A sagittal dissection is also in that direction, but it's not exactly mid. The coronal or frontal plane divides the front half of a person right here from the back half. So it is frontal divides your anterior side from your posterior side. Okay. Transverse, I always think of like a magician cutting a person in half, is a horizontal plane dividing a person at the waist. So transverse is across the umbilicus. Okay, so I used a lot of words there, and these are the ones you kind of want to make sure you know. Anterior or ventral being front, posterior or dorsal being the back. And dorsal, I always think of like a dorsal fin on a shark is on their back. Medial meaning middle. So medial is anything that's from the frame of reference, meaning towards the middle. Lateral is on the side or to the side. So if we lay someone on their side, they're in a lateral position. Now this is tricky with a foot. Believe it or not, this is the dorsal side of the foot. There's a back side of the foot. And it's kind of a top of what we call the top of our foot. The plantar surface, if you remember which side is plantar, you can remember which side is dorsal. I always think of plantar fasciitis or plantar warts, or that's always on the sole of the foot. And you plant your foot on, you plant your foot down, the sole of the foot. So if you can remember plantar, you can remember the other side is dorsal. Distal and proximal has to do with farthest or closest. So if it's proximal, it's closest to the core. If it's distal, it's farther or furthest out. Superior means toward the head, and inferior means toward the away from the head. One of the terms is caudal, which happens to be toward the tail. Now, we don't have a tail, but if we had a tail, it would be, on the backside, kind of right here. So caudal meaning toward the tail, and cephalad meaning, or cephalo, toward the head. So superior toward cephalo, inferior kind of down toward the tail. But this all depends on your frame of reference. Some words for color here. We have erythro, meaning red, albino or leuco for white. Black is melano. Blue is cyano. Yellow is cirrho or jondo. Think jaundice, think cirrhosis of the liver. Both will make you yellow. Polio, that's a tricky one. And polio means gray. I might star that if I were you, because that doesn't really kind of make sense. Gray or gray matter of the brain and spinal cord. We'll see this again when we talk about the nervous system for the brain and spinal cord. And chromo meaning color. Somato is body. Soma, somato is a general term for the body. So the somatic system has to do with the body. Okay, some vocabulary terms. Febrile means fever. Etiology. Ology meaning the study of, the cause. So why did I get tonsillitis? What was the cause? What was the causative agent? Which microorganism gave that to me? That's etiology. Idiopathic, pathos meaning disease, pathy meaning disease, pertaining to disease. Idio is unknown. So I always think of like an idiot doesn't know anything, right? An idio. So pertaining to idiot disease, pertaining to unknown disease is better. Okay, so diagnosis is the cause and the nature of a disease. So you would say a diagnosis is almost like a proclamation of what it is, right? Prognosis, pro in the front, is forward or looking ahead. It is the prediction of the course of the disease. Gnosis is knowledge. So it's foreknowledge. It's the foreknowledge of the disease. So in other words, I have Lyme disease. I can still live a long and healthy life with Lyme disease, would be the prognosis. So diagnosis, Lyme disease. Prognosis is the prediction. Okay, morbidity and mortality. So this is a little tricky. Morbidity, I think of rate of illness, the proportion of illness. So how many people got sick, how many people are diseased. And mortality is the rate of death. So if you had a mortal wound, it's going to cause your death. So that's how I remember that. And I always, when I'm teaching a live class, I ask the question, did COVID have a high morbidity or low morbidity, or high mortality or low mortality? Considering numbers, COVID really had high morbidity. A lot of people got sick. A lot of people got sick more than once. But in proportion to the morbidity, the mortality was pretty low for COVID. People get COVID, and at least now that we're past the initial phase of the pandemic. So morbidity high, mortality low. The converse of this would be something like Ebola. I don't know anybody of my family or anybody that's gotten Ebola, but Ebola has low proportion of illness, right? Not a lot of people are getting it, but if you got it, there's a high percentage likelihood of death per population. So low morbidity, high mortality. Sepsis is a pathological state. Inflammation. Inflammation is your body's way of protecting itself against either injury, infection, or allergy. Okay? When inflammation gets overreactive, we can have anaphylaxis, which we'll talk about in a little bit. But inflammation has to do with pain and heat and redness and swelling, and all of these things cause loss of function. It's the body's way of saying, protect that elbow, it's hurt. Okay, homeostasis means internal stable environment, equilibrium, internal balance. And the entire, the body is constantly adjusting itself to achieve homeostasis. Perforation just means like penetrating a hole in something. So if you perforated the bowel, for example, a hole is torn into it. Anatomical positions. Again, this chapter is so beneficial. So supine is laying face up on the back. Prone is laying on your abdomen. Okay, sign versus symptom. So a sign is objective. Vital signs are objective. A sign is something you can observe through your senses. So you heard it, you saw it, you smelled it, or it's a measurement, it's objective. A symptom is subjective, meaning it cannot really be observed. So that would be nausea. You can't see someone's nausea. You can see the after effects, but you can't see that. Headache. You can't see headache. You can see evidence that's objective that lends itself toward a headache, but you can't see that. Pain, itching, all subjective symptoms. Okay, so there is again a practice section in here, and I'll let you go ahead and do that yourself. Just going to double check here and see if there's any. Lots of practice here, which is good. Sometimes we have abbreviations toward the end of our PowerPoints, and I just want to make sure I've covered what you need to cover. Yes, so what I would recommend for you to do is go through the slides, and like I just taught you, subjective indicator of disease, and you're going to ask yourself without peeking, what is that subjective one? Is it a sign? Is it a symptom? What was that? It's a symptom, and you can go through the PowerPoint and kind of quiz yourself. And we have Quizlets, but this is another way to kind of study. Again, repetition is everything. Okay, I'm going to stop here.